Picture this. A retired mailman, 74, walks 2 miles with his dog every morning, rain or shine. Lately, by 4 in the afternoon, his legs feel packed with wet sand. His doctor tells him that's just part of getting older. That story has a name in the research, and today we're talking about it honestly. Here's what I'll show you. By early afternoon, your legs feel different, heavier, like you're wading through water instead of walking on solid ground. You stand up from the couch, and for a second, your legs need a moment to catch up. You look down, and there's a faint line where your sock used to sit, pressed right into your skin. Maybe your shoes feel a little tighter by dinner time than they did at breakfast. Maybe you've started propping a pillow under your ankles at night without fully knowing why it helps. Sound familiar? It's completely reasonable to wonder about this. Most people over 60 do at some point. Picture someone in this situation, a retired school teacher, 68 years old, still gardens every morning before the heat sets in. She used to walk her whole block without thinking twice. Now, by 4 o'clock, she has to sit down halfway through watering her tomatoes. Her legs ache in a way they never used to. A dull, heavy ache that wasn't there 5 years ago. She mentioned it once at a checkup. Her doctor nodded, said it was common, and moved on to the next item on the list. She figures it's just her age catching up with her. It isn't the whole story, not even close. Here's the part most people never get told. Heavy legs are not one problem. There are at least 2 different problems wearing the same disguise. And figuring out which one you have changes almost everything about the fix. I'm Dr. Aliza Wright. On this channel, I review published research on senior health, and I translate it into plain English. The kind of explanation a 15-minute appointment rarely has time for. I'm not your treating physician, and nothing here replaces your own doctor's exam. What I can do is show you what the research says and what you can try starting today. Before we get into it, drop one word in the comments. Just yes or no. Does this sound like your afternoons too? It takes 3 seconds, and it genuinely shapes which topics I cover next. I read every comment on this channel. If you're new here, stick around. This next part took me longer to research than almost any other video on this channel because the real explanation isn't what most people assume. Not even close. Think of the veins in your legs like a one-way staircase for blood. Blood in your feet has to travel back up against gravity, all the way to your heart. Every step you take, your calf muscle squeezes those veins and pushes blood upward. Then tiny one-way valves inside the veins snap shut, so the blood can't slide back down. It's a little like stepping on a garden hose over and over in a steady rhythm, forcing water forward instead of letting it sit still. Researchers who study circulation describe the calf as working almost like a second heart for your legs, responsible for the large majority of the blood that makes its way back up every time you walk. Here's where it gets interesting. When those valves get old or stretched or damaged, they stop closing all the way. Blood slips backward, it pools, pressure builds in the vein, and that pressure is what you feel as heaviness, aching, and swelling by the end of the day. Doctors have a name for this, chronic venous insufficiency. Most people just call it CVI. According to Yale Medicine, this condition affects somewhere between 10 and 35% of adults, and your risk climbs the older you get. But wait, heavy legs don't always mean a vein problem. There's a second, very different cause. And mixing the two up can make things worse. Sometimes the issue isn't blood pooling on the way back to your heart. It's blood struggling to get down to your legs in the first place. Doctors call this peripheral artery disease, or PAD. Instead of veins, the problem sits in the arteries, the vessels carrying fresh oxygen-rich blood down to your feet. When those arteries narrow from years of gradual plaque buildup, your leg muscles don't get enough oxygen when you're active. That can feel like heaviness, cramping, or fatigue, especially in your calves and especially while you're walking. Here's a number that surprised me the first time I read it. A study built on National Health Survey data, published in the journal Circulation, followed 2,174 adults aged 40 and older, 2,174 people. Researchers measured blood flow using a simple painless test called the ankle brachial index. It compares the blood pressure in your ankle to the blood pressure in your arm. Among the adults in that group who were 70 and older, roughly 1 in 7 showed signs of reduced blood flow to the legs, whether or not they had any obvious symptoms at all. 1 in 7. Sit with that for a second. So now you've got two very different plumbing problems hiding behind the exact same complaint. One is backflow, blood pooling because the return valves are worn out. The other is restricted flow, blood struggling to get down there in the first place. Both can make your legs feel heavy. Both become more common with age, and they call for genuinely different approaches, which is exactly why guessing at home without a proper check from your own doctor isn't the move here. Here's the reassuring part. For most people watching this, the cause is the venous side, the one-way valve problem, not blocked arteries. According to both the Mayo Clinic and the Cleveland Clinic, venous heaviness tends to follow a pattern. It's usually worse by evening. It usually improves after you elevate your legs overnight. It often comes with visible veins or a sock line that presses in by the end of the day. Arterial issues tend to show up differently. Pain that shows up specifically during activity and eases with rest, or discomfort at night that gets better when you dangle your foot off the edge of the bed. Neither one is something to self-diagnose from a video, but knowing the difference gives you a much sharper conversation the next time you see your doctor. One more detail worth knowing. According to Yale Medicine, this condition shows up somewhat more often in women, usually as visible varicose or spider veins, but men are more likely to develop the more severe form, even though it gets talked about less. If you've spent years on your feet for work in retail, nursing, teaching, or a factory floor, that history matters here too. It's not about blame. It's about understanding your own particular starting point. This next part is the one I almost left out because it sounds too simple to be true. If your issue is the venous side, the pooling, the tired valves, the calf muscle pump we just talked about is also the fix. A trial published in the Journal of Vascular Surgery had patients follow a short, structured program of calf exercises. Researchers didn't just ask people how they felt afterward. They measured directly how well the calf was pumping blood back toward the heart. The pump function improved measurably. Mayo Clinic and Cleveland Clinic both point to a few other things that raise your risk over time: sitting or standing in one position for long stretches, carrying extra weight, a family history of vein problems, or a past blood clot. Even certain blood pressure medications can play a role, which is one more reason to loop your doctor in rather than adjusting anything on your own. None of these things mean something is wrong with you personally. They just explain why this becomes more common as the decades add up, one birthday after another. If you're still with me, this next section is exactly why we made this video. Here are 4 things based on published research that are worth bringing up with your own doctor. Number 4 is the one almost nobody mentions. And number 1 is the one that takes 3 minutes and costs nothing at all. Step 1. The calf pump routine. Since your calf muscle does most of the work pushing blood back up your leg, waking it up on purpose several times a day gives it a mechanical advantage. Here's a simple version researchers have studied. Sit or stand somewhere stable, holding onto a counter or chair back if you need the support. Point your toes up toward your shins 10 times, feeling the front of your lower leg do the work. Then rise up onto your toes and lower back down slowly 10 times, feeling your calf do the squeezing. Then march in place, lifting your knees gently for 1 minute, letting your whole leg join in. That's the whole routine. 3 minutes, 3 moves, done 2 or 3 times across your day. Ask your doctor whether this kind of movement is appropriate for your specific situation, especially if you have any known heart or artery condition. Step 2. Elevation, done on a schedule, not just when you remember. Several times a day, prop your legs up above the level of your heart for 10 to 15 minutes. A couple of pillows under your calves while you watch the news works just fine. Gravity does the work your valves are struggling to do on their own, letting pooled blood drain back toward your heart without any effort from your muscles at all. Both the Mayo Clinic and Cleveland Clinic list this as one of the simplest, lowest-cost tools for reducing venous pressure. But here's where most people get it wrong. They elevate their legs once at night and expect that to undo an entire day of standing or sitting still. It doesn't work that way. Little and often beats long and rare. 5 short sessions across your day outperform 1 long one before bed. Step 3. Compression. Graduated compression stockings apply gentle pressure that's tightest at the ankle and loosens as it moves up the leg, helping blood move in the right direction. Mayo Clinic experts note that for people with a history of leg ulcers or blood clots, wearing them consistently is often recommended long-term. Here's the important caution. If your issue turns out to be arterial, the PAD we talked about, compression can sometimes make things worse, not better. This is precisely why Step 3 needs your doctor's input before you buy anything. Ask specifically which compression level is right for you and confirm your circulation type first. Step 4. The one almost nobody mentions. Break up long stretches of sitting or standing, even briefly. If you're sitting for a movie, a car ride, or a long visit with family, aim to shift position, flex your ankles, or stand up for a minute or two every 30 to 45 minutes. Set a gentle reminder on your phone if that helps you remember. Vascular researchers note that this single habit change activates the calf pump without requiring a formal workout at all. It's the quiet, boring one. It's also the one your veins will thank you for the most, day after day, long after the excitement of a new routine wears off. Now, if you have a parent, a spouse, or a friend who mentions their legs feel heavy by dinner, this is worth 60 seconds of their time too. Send them this video. It might save them a confusing, unexplained conversation at their next appointment. Here's a fact worth remembering and repeating to anyone who asks why you started doing ankle pumps during commercial breaks. Your calf muscle, quietly working while you walk, handles the overwhelming majority of the effort of moving blood back up from your feet to your heart. Skip using it for most of the day, and that's often when the heaviness creeps in. Now, I want to answer the question I know is sitting in your head right now. If this is really just aging, why bother doing anything about it at all? Here's the honest answer. Age raises your risk. It doesn't seal your fate. The valves and arteries in your legs respond to how you use them today, this week, this month, not just to the number of birthdays you've had. That's not a guarantee of any particular result, and no video can promise you one. It's simply what the published research consistently points toward over and over across different research teams and different decades. Let me name the sources one more time because you deserve to know exactly where this comes from. Yale Medicine publishes patient-facing summaries on chronic venous insufficiency, including how common it is and who's most at risk. The Mayo Clinic and Cleveland Clinic both maintain detailed clinical guidance on managing venous symptoms through elevation, movement, and compression. The American Heart Association's journal, Circulation, has published population research using the ankle brachial index to track peripheral artery disease across age groups. And the Journal of Vascular Surgery has published controlled research measuring how structured calf exercise affects pump function directly, not just self-reported comfort. There are situations, though, where a video like this one isn't enough, and you should call your doctor today, not next week. If one leg suddenly swells and it's painful, warmer than the other leg, or noticeably redder, that needs same-day attention because it can signal a blood clot. If your foot or leg turns pale, cold, or bluish, especially along with new pain, that also needs urgent evaluation because it can point to a sudden blockage in an artery. If you develop an open sore on your leg or ankle that isn't healing, that needs a doctor's eyes on it directly, rather than a home remedy. If pain in your leg wakes you up at night and doesn't ease no matter how you shift position, that's worth a same-day call as well. And if you're having chest pain, sudden shortness of breath, or sudden weakness on one side of your body, that's an emergency. Call 911, don't wait, and don't watch the rest of this video first. These situations sit outside the scope of anything a video can safely walk you through. They need direct, hands-on evaluation. Everything else we've covered today is meant to complement your doctor's care, not replace it. Let me run through the core points quickly. Heavy legs after 70 usually come from one of two very different plumbing problems: pooling blood from worn valves or restricted blood from narrowed arteries. Most cases are the venous kind, and the calf muscle pump is both the source of the relief and, when it's underused, part of the original problem. A short 3-minute routine done consistently, along with scheduled elevation and the right compression, can genuinely support how your legs feel by evening. Breaking up long stretches of sitting or standing matters just as much as any single exercise. And certain red flag symptoms deserve a same-day call to your doctor, not a wait-and-see approach. Here's the whole message in one sentence. Your legs were built with their own built-in pump, and most heaviness comes down to whether that pump is getting used or sitting idle. If this helped you see something new, subscribe. I put out a new deep dive on senior health every single week. Next week, I'm walking through the surprising research on why so many people over 60 wake up between 2 and 4 in the morning, and it has almost nothing to do with what most videos claim. In the comments, I'd love to hear, which of the 4 steps are you going to try first? Before you go, there's one more thing I haven't told you yet, and it's the reason next week's video matters just as much as this one. The same nightly circulation patterns driving that heavy, achy feeling in your legs are quietly connected to why so many people your age wake up in the middle of the night. We'll get into exactly how next week. One last thought before you go. None of this requires a gym membership, a new gadget, or a special diet plan. It requires 3 minutes, a chair, and a little bit of consistency. That's genuinely the whole idea behind this channel. Taking what the research shows and turning it into something you can start today, not someday. Take good care of yourselves. I'll see you next week. This video is for general educational and informational purposes only. It is not medical advice and does not create a doctor-patient relationship. Please always consult your own qualified healthcare provider for diagnosis and treatment. Illustrative scenarios in this video are composites. All identifying details have been changed to protect privacy. Any resemblance to a specific individual is unintentional. Portions of this video use AI-assisted voiceover and visuals.